after I had my mastectomy, I had 30 rounds of radiation. So in this video, I'd like to walk you through what to expect at all of your radiation appointments so that it runs more smoothly for you. First of all, let me begin this video by saying and reminding you that everyone's breast cancer journey is different. Everyone's radiation treatment is unique to them, and you will hear me say that over and over in this video. Always ask your care team about any questions that you have for your personal breast cancer journey and for your radiation plan. I do not replace your doctor or any part of your care team. So if anything that I say conflicts with what your care team says, ask your care team to clarify any questions that you have. Everything that I share in these videos on my channel is from a breast cancer survivor's perspective. Not to discount a breast cancer survivor's perspective, but it in no way should replace anything that your care team is telling you. You go with them first, and if you have questions or reservations about them, get a second opinion from another care provider, not from the breast cancer community, unless somebody in the breast cancer community happens to also be some kind of breast oncologist. So let's get started on this video. First, I'm going to begin talking about my personal journey, and then second, I'm going to talk about what to expect at your first appointment consultation. That's your first appointment, is a consultation. And then third, I'm going to talk to you about what to expect at that second appointment. That one is called a simulation. Fourth thing that I'm going to talk about is your third appointment, and that is a dry run. And then the fifth thing I'm going to talk about is the rest of your radiation appointments. So let's begin. First of all, I started out with chemotherapy. I had 4 rounds of adriamycin Cytoxan, which is also called the Red Devil, and then 12 rounds of Taxol. Then I had a single mastectomy to my right hand side because I was stage 3, because I had cancer found in a sentinel node in my right arm. They automatically went ahead and took all of the lymph nodes out of this right arm. It's on the right side, but on from your screen it's going to look like the left side. Every single person has a different number of lymph nodes in their arms. I had 11. They took out all 11 of those lymph nodes, and 4 of them had minute traces of cancer found in them. So the treatment plan that was recommended for me following up from my mastectomy and the pathology was to have 30 rounds of radiation. Now, granted, I was called NED, or no evidence of disease. That's because all of the lymph nodes were already taken out that had the minute traces of cancer in them. But so this was more like a precautionary measure, because they cannot guarantee, as you probably know if you saw my last video. I'll try to put a video card of it so you can reference it if you haven't seen it. Just because you're called NED, or no evidence of disease, does not mean that you are cured. They hesitate to use the word cured because they cannot see every single cancer cell there is. Obviously, they can't see it with the naked eye, but even with their imaging equipment, they may not find little minute traces of cancer. So this was a precautionary measure for them to recommend the 30 rounds of radiation. I was also put on 5 years of hormone blockers initially, And then at that 5-year mark, they decided that it would be a good idea for me to have 5 additional years of hormone blockers. This fall should be my last year, hopefully, of the hormone blockers. Now, again, I have told you, and I want to keep emphasizing, I cannot stress this enough, everybody's breast cancer journey is different. Everybody's breast cancer treatment is different. You may have hormone blockers if you're hormone positive. You may not. You may only have 5 years of hormone blockers. You may have 10 years of hormone blockers. Your care team may decide to put you on 5 years of hormone blockers, but then they work with you every step of the way. If they are a good care team, they may stop those hormone blockers before the 5 years are up, or they may extend them. Some people even have hormone blockers after their 10 years because they just decide they want to continue to go on them. Everybody's care plan is going to be unique to them. So the first appointment should be a consultation appointment. It's kind of a getting to know you appointment. At every single one of your appointments, they're going to usually ask your name and your date of birth, and this is because your radiation is your radiation. It is no one else's radiation. So they want to make sure that they are giving you the correct treatment every single time that you go in for radiation. So that will be set up. And when I say everything about that radiation appointment is unique to you, the dosage, the placement, your positioning, everything. And I'm going to go into more detail and elaborate more on what that means. It may be different for you. Like I said, every single breast cancer patient is different. You may be at a different clinic. This was about 9 years ago, so even at MD Anderson, they may have switched things up. But the main idea to get from this is that they want to make sure that they are giving you your radiation treatment and not somebody else's. When I went to MD Anderson for my radiation treatment, at every single appointment, every single time, I had to give them a card, and it had my name, my date of birth, medical record number, anything that they needed to access that would help them make sure that I was who I was and that I was there for the treatment they had uniquely for me. The first appointment that you're most likely to have is a consultation appointment. This is the appointment where you're getting to know your radiation oncology team and they're getting to know you. This consultation appointment, that first appointment with your radiation oncology team, is going to include discussing your medical history, and you will have a physical examination. They will examine the area that was affected, your mastectomy, and make sure that you're good to go. A nurse will meet with you and go over a health assessment and prepare a health assessment, and then your radiation oncologist will meet you and talk about your diagnosis and stage and other things unique to your cancer journey. Your radiation oncologist will talk to you about the potential risks and benefits of radiation. They'll talk about the benefits that you personally have for your breast cancer journey with radiation, how much help it is giving for you personally. They'll give you probably a percentage of how it will help your personal breast cancer journey and your personal lifespan, or how much it doesn't. So that pretty much clears up what happens at the consultation visit. In review, they're going to go over technologies, most likely, your potential regimen, how many treatments or rounds you're probably going to have, what to expect at the appointments, and possible side effects to expect, potential complications, and expected outcomes. If you decide that radiation is a good next step for you, then the nurse will come back in and go over instructions to prepare you for your next visit. Your very first appointment with your radiation oncology team usually doesn't last more than an hour. Now again, everybody can be different, but most people can expect for your very first radiation oncology appointment to be up to an hour. So that pretty much clears up what happens at the consultation visit. In review, they're going to go over technologies, most likely, your potential regimen, how many treatments or rounds you're probably going to have, what to expect at the appointments, and possible side effects to expect, potential complications, and expected outcomes. Your second radiation appointment is a simulation. It's more specifically called a computer-guided tomography. You'll lay on a bed that goes in and out of a donut-shaped machine that takes pictures and records images. They'll explain everything to you and even help place you on the table for your CT. They may make a mold to help position you in the exact position that they need for your future radiation appointments. This is a beanbag that they place in position. They put it on underneath you usually, and it molds to your shoulders and in the exact position that they need you in for all of your actual radiation appointments. Now, they may mark up your skin with these itty bitty tattoos. They're no bigger than a freckle. In fact, I will show you pictures of my tattoos in just a few moments. This is to help them precisely target the radiation where it needs to go. And this is a reason that you shouldn't have to worry much about radiation exposure to your heart or your lungs. They also have deep breathing techniques where you breathe in deeply, hold the breath, that expands your ribs and your lungs, which pushes down your diaphragm and pushes your heart out of the way. That allows the radiation technicians a few centimeters for more precise targeted radiation to places that might be close to the heart or lungs. Your radiation technicians may also mark your skin up with a marker, cover it with a sticker to help them keep precise location of the targeted radiation therapy. And this keeps them in place for all your future appointments. Your radiation therapists will take pictures of these marks and also your position in your mold. All of the images that your radiation technicians take on the simulation day, your second appointment usually, will be put in your medical records for reference so that they have them for each actual radiation appointment that you have. Don't worry that the markers will be removed on accident. You can take a shower. Just don't take the stickers off of your skin unless they tell you you can, and don't deliberately try to wash off the marks. After this second appointment, the simulation appointment, your radiation oncologist will map out your treatment. It's individual for you, only for you. Every single breast cancer patient, every single cancer patient has their own treatment plan with any type of treatment they have, be it chemo, radiation, even hormone blockers. It's specific to you, and I can't stress it enough that even if you have a similar breast cancer journey to somebody else in a support group or somebody else that you meet, all of your treatment is designed specifically for you. It's not a cookie cutter process. You are important. Did you know there's an entire team behind your care plan? And I'm talking about your entire breast cancer journey, but also specifically when you have radiation treatment, there is an entire team behind that as well. This second appointment, the simulation appointment, should only take about an hour. Now, like I always say, everybody's journey, everybody's care plan is different, but the average time probably will be within an hour. Between your simulation appointment, which is your second appointment, and your dry run, which is usually your third appointment, your radiation oncologist is going to map out your customized radiation treatment plan. And they are not doing this alone. In addition to having a radiation oncologist and their nurse or nurses and their radiation technicians, when they're mapping out the customized radiation treatment, that includes the radiation oncologist, a medical physicist, and correct me if I'm pronouncing this wrong, but I think it's a dosimetrist. What in the world even is a dosimetrist? They study and practice determining doses and measurements and calculations of customized radiation for each patient. These people are included in your mapping. This doesn't even include your nurses, and your radiation technicians, who you will see on pretty much a daily basis. In contrast, the people mapping out your radiation treatment plan that I just mentioned, those people are a lot like the people that were behind the scenes in the pathology of your breast cancer. You probably will never meet them except for the radiation oncologist. They're behind the scenes. There are so many people that are behind the scenes in your breast cancer journey, in your care plan. You usually have one more simulation appointment before you have your actual real radiation appointments with real radiation. And this is called a dry run. This is the third radiation appointment that I'm talking about. A dry run goes from 15 to 30 minutes long, and it's where they take images of your radiation area and your markings. They're basically making sure that everything's lined up where it should be. Before you leave this dry run appointment, you may have all of your future radiation appointments scheduled. The number of radiation treatments that you have depends on your own unique care plan, including things like your stage and the type of surgery you had and other factors. And you can discuss this with your radiation oncology team. They're going to need you to hold still so that they can use your radiation tattoos and markings to properly position and align you, and they will adjust your position as needed. They may even take more pictures before you get your radiation. The radiation technician will then leave the room, but don't worry, they're not going too far away. They're usually in the room right next door, and they are able to monitor your video and audio from your room. So if anything goes wrong, you can still communicate with them. You'll receive your radiation according to that mapping and treatment plan that I talked about earlier. During your radiation, you usually don't see or feel anything, but you may hear a faint buzzing sound. And the machine does move around you. Now let's talk about the actual radiation appointments. They usually don't last more than 15 to 30 minutes every time. When that appointment treatment's done, the radiation therapist will return to the radiation room that you're in. They can assist you off of the table and help you get up, and then from there you can change back into your regular clothes and go home. When you go to your radiation appointments, it's really a good idea to wear comfortable clothing, something that's not going to be tight against your chest, something that is comfortable, that because think about it, when you have cumulative effects to your skin from radiation, it can be a little bit tender and maybe raw. We'll talk about side effects in the next video. but you want something that's easy to take on, to put on and take off. When you go to each and every one of your radiation appointments, they usually provide you with a gown, and you have to take your shirt off. At my appointments at MD Anderson, they provided lockers for us. Anything that we weren't wearing or we wanted to keep safe, we could keep in that locker. The lockers had a key inside the key lock attached to a bracelet. Those were the available lockers. So you would find in one of those lockers and put your valuables, anything you couldn't take with you, and put it in that locker, and then take the key and the bracelet with you. And then after your radiation appointment, you would just go back to that locker, take your stuff out of there, put the key back in for somebody else to use that locker. And then you'd go to the changing room and change back into your clothes so you could go home. And just simply put the gown in a hamper provided, usually in the changing room. Most radiation oncology clinics allow you to keep your shoes on during your appointments, but you definitely need to put a gown on and keep your shirt in your locker.
You're never told that life could ever get this way. This bill's a joke, you're broke, your love life's to your weight. This journey